All right, so today we are going to look at lectures on understanding the implications of ethical and legal issues within the health and social care, which is LO4 in the health and social care provision within the Ascentis nursing program. Now, it is important that we understand that LO1, LO2 look at various components within the health and social care sector. And we're not able to do LO3. We'll do that in next. But today we'll look into the ethical reason, the perspective underlying decision making. So what there is an ethical perspective in health and social care. What is that? So ethical perspectives are essential when dealing with sensitive issues that arises in this field. Principles of ethics: respect for autonomy, beneficence, non-malfeasance, and justice. There are 4 principles of ethics: respect for autonomy, beneficence, non-malfeasance, and justice. Okay, so these are the principles of ethics. Okay, now when we say autonomy, what do we mean? Or what does it mean when we say autonomy? Okay, so autonomy is therefore the principle that refers to individuals' right to make their own decisions about their health and well-being. In HSC, respecting patient autonomy means providing them with all the information they need to make informed decisions about their care. Very important. And then beneficence. What's that? The principle that involves taking actions that promote the well-being and health of patients. In HSC, practitioners must prioritize the best interest of the patients when making decisions about their care. Okay, it's very, very important. You need to prioritize there, especially when you're talking about end of care. How the patients wants this end of care to end. We need to prioritize that over our own priorities. Okay. The non-malfeasance, the principle that involves avoiding actions that may cause harm to the patients. In HSC, practitioners must take steps to prevent harm and minimize any potential risks associated with treatments or interventions. Okay. Then justice. This principle involves treating all patients fairly and equally, regardless of their background, status, or other factors. In HSC, practitioners must ensure that access to care and resources is distributed equitably. Okay. Principle involves treating all patients fairly and equally, regardless of their background, status, or factors. Okay. Then we have confidentiality. The principles involves respecting patients' privacy and keeping their personal information confidential. Okay. Confidential. And then what then is fidelity? This principle involves being faithful to commitments made to patients and maintaining a relationship of trust with them. Okay. In HSC, practitioners must act in the best interest of the patients and honor their commitments to provide care and support. Very important. Okay. The difference between confidentiality and fidelity. Fidelity is that you remain faithful to the commitment made to the patients and maintaining a relationship of trust. Okay. Where confidentiality is more about the personal information. Okay. Then we have to look into the implications of ethical and legal issues within the health and social care. Ethical and legal issues within health and social care have significant implications for the individuals involved, as well as for healthcare providers, organizations, and society as a whole. These are the reasons. Now, patient safety. Ethical and legal issues can impact patient safety, leading to harm or even death. Healthcare providers must ensure, therefore, that they follow ethical principles of benevolence, doing good, non-malfeasance, not doing harm, autonomy, respecting patients' autonomy, and legal requirements such as informed consent, confidentiality, and accurate documentation also play a significant role in patient safety, trust, and confidence. Ethical and legal issues can erode public trust and confidence in healthcare providers and organizations. Patients and their families must have confidence that healthcare providers will act in their best interest and that their privacy and confidentiality will be protected. Very, very important. Then let's look at professional accountability. Where we are professional accountability leading to disciplinary actions and legal consequences. Okay. Healthcare providers must adhere to professional standards and codes of conduct. Failure to do so could harm result in disciplinary actions. Is that Josephine? Is that Josephine? Josephine, can you unmute yourself? Can you hear me? Hello? Hello, Josephine? Josephine? Hello, Josephine? Josephine, can you hear me? Hello? Hello? Hello, Josephine? Josephine, can you hear me? Hello? Okay, let me proceed. I think. So let's look at trust and confidence. So we spoke about trust and confidence. We also look into resource allocation. Now, ethical and legal issues can impact resource allocations, leading to difficult decisions about how to allocate scarce resources fairly and equitably. Healthcare providers must ensure that resources are used effectively and efficiently while respecting patients' rights and dignity. Very important. Okay. Resource allocation. Ethical and legal issues can impact resource allocation, leading to difficult decisions about how to allocate scarce resources fairly and equitably. Healthcare providers must ensure that resources are efficiently and effectively done, respecting patients' rights. Let's look at health disparities. Ethical and legal issues can contribute to health disparities where certain populations experience unequal access to healthcare services and outcomes. Healthcare providers and organizations must work to address systematic and structural issues that contribute to health disparities. It's very important we look into it. So overall, we can say ethical and legal issues care are profound implications for individuals, healthcare providers and organizations, and society as a whole. Addressing these issues requires a commitment to ethical principles, adherence to legal requirements, and the willingness to engage ongoing reflection and dialogue about how best to promote the health and well-being of all individuals. Okay. So uh, so these are some of the ethical contexts that we can look into. So we have the ethical context as the informed consent, confidentiality of care, the autonomy, fair belief, genetic engineering, cloning, organ donation. So these are things that you can look into when it comes to informed consent. It refers to the right of individuals to be fully informed about their medical treatment or procedure. They need to know. We need to relay all those informations to them. Then confidentiality refers to duty of healthcare professionals to protect the privacy of their patients. Very important. Then duty of care refers to the obligations of healthcare professionals to provide the best possible care for their patients and to prioritize the safety and well-being of their patients above all other considerations. Okay. So these are things that we have to look into. Okay, then let's look at the legislations. Okay, what we call the GDPR, General Data Protection Regulation, GDPR, safeguarding health and safety at work, storage and handling of substances, mental health and mental capacity. Okay, the Human Rights Act 1998, Equality Act 2010. These are things that we need to be conversant with or familiarize ourselves with. Okay, the Human Rights 1998. It therefore outlines the rights and freedoms of individuals in UK, including the right of life, the freedom of speech, and the protection from discrimination. The legislation therefore has significant implications for the provision of health and social care services, as it ensures that individuals are able to access service without fear of discrimination or infringement of their rights. Okay. Equality Act 2010. It provides a legal protections against discriminations on the basis of age, disability, gender, race, religion, or sexual orientation. This legislation ensures that individuals are able to access health and social care services without fear of discrimination, and that healthcare professionals are able to provide care that is sensitive to the needs and preference of diverse patients populations. Okay, very important. So you need to treat all persons fair and equal. Then let's look at the Care Act 2014. It underpins the legal framework for the provision of social care services in England, including provisions related to assessment, eligibility, and support for vulnerable individuals. These legislations have significant implications for the provision of social care services, as it ensures that individuals are able to access high quality care that is tailored to their specific needs and circumstances. Then data protection. Data protection. I've mentioned that data protection looks into handling and storage of information. It could be the medical records of the person, and this should be in alignment with the General Data Protection Regulation, what we call the GDPR. Okay. Safeguarding. Safeguarding is very important as to legal framework of protection of vulnerable adults and including children as well. So you have a duty of care, and one of the duty of care is safeguarding. Okay, you have to protect the patients. Okay, very important. Then the health and safety at work that borders around fire assessment, fire risks. There's make sure that the COSH, handling of substances are RADO, reporting of injuries. So these are all in health and safety. The storage of handling stuff I spoke about COSH, control of substances as adults to health. That is what we call COSH. And then mental health and mental capacity. Okay, it allows the legal framework for the provision of mental health services, including provisions related to involuntary detention and treatment. This legislation ensures that individuals with mental health conditions are able to access high quality care that is sensitive to their unique needs and circumstances, while also protecting their legal rights and freedom. Okay, so this is very important when it comes to by adhering to these policies and codes of practice. Healthcare professionals can ensure that they providing high quality care that is guided by professional and ethical standards and that respects the rights and dignity of all individuals. Let's look at the National Health Service. What does it do? It aligns the principal values of the NHS in the provision of care, including the principles of patient-centered care, respect, and compassion. Okay. Then we have the MSc Code of Conduct that is relative to nursing, the nursing profession, the National Midwifery Council. Then you have the Social Care Commitment, the Children's Act 1989, the Adult with Incapacity Scotland, and the Code of Ethics. Okay, these are things that you have to look into. Any question at all? Hello? Hello?
Hello.
Do you have any question
About what?
about what has been discussed so far?
Sorry, I'm been struggling to log in since I just get through now. I didn't get anything.
I have been saying hello, hello. So on the video, I've been asking, can you hear me several times?
I'm very sorry. I just got through now. I didn't hear anything.
Okay, but you have the slides in your model. You're going to get a recording. Okay, so let's proceed. Okay.
Okay.
Yeah, so let's look at the set standards of practice within the ethical and legal framework of a social care. Okay, so setting standards of practice and ethical and legislative frameworks for practice are important components of ensuring high quality health and social care services. By setting standards of practice and ethical and legislative frameworks, healthcare professionals can ensure that they are providing high quality care that is guided by ethical and professional principles and that respect the rights and dignity of all individuals. These frameworks also provide a foundation for ongoing professional development, quality improvement, and accountability, having to ensure that healthcare services are effective, safe, and responsive to the needs and preference of diverse patient populations. Okay, this is very important that you have to know these things, and you can get most of this on your model. So, what are some of the standards? Okay, establishing professional bodies and organizations. Can you hear me now?
Yeah.
Okay, so some of the standards establishing the professional bodies and organization. The ethical framework will therefore be developing codes of ethics and conduct. What will be the legislative framework? Creating laws and regulations that govern health and social care. Okay. Let's look into before this session, I've already explained some of the legal frameworks that we have to um, adhere to as care professionals or nurses. One of them we spoke about Equality Act. We spoke about
All right.
the Safeguarding Act, where we have to protect our patients. We spoke about duty of care, that healthcare professionals have duty of care towards the patients that they take care of. Okay. Yeah, so
Okay.
these are things that we spoke about. We also spoke about the GDPR. You know what is a GDPR?
Mm,
Do you know the GDPR?
no.
Are you a carer?
Yeah, I'm a carer.
So GDPR is the General Data Protection. Okay.
Okay. Yeah.
Yeah. So you should be able to make sure that anything that you do, information handling, it needs to align itself with the General Data Protection Privacy. Okay. That's what we call it. Then we spoke about confidentiality. You know about confidentiality?
Yeah.
Okay. So confidentiality, therefore, is personal information about the patients that you take care of. You don't share it to other people.
No.
Then we spoke about trust and respect. So these are things that are part of what we call the ethical framework in healthcare. Okay.
Okay.
So you consent is one of the key things when it comes to once you are promoting a person-centered care, you need
Mm-hmm.
to make sure anything that you do, you need to seek consent from the patient.
You
Okay,
need to ask.
exactly. And their priorities are the key thing. It overrides our priorities. Okay. So, for
Yeah.
instance, if the patient is on end of life care, there would have been certain things that the patient would have asked, or the family of the patient would have asked, or the nurse of kin would have said that because my mom end of care, this is how we want your mom to die. Okay.
Yeah.
So those are their priorities, and we need to adhere to their priorities rather than what we want to do as carers. Okay,
Yeah.
that's fine. So we also have what we call the British Association of Social Workers. It's a professional association with social workers in the United Kingdom. Here are some of the key points about BASA. BASA was established in 1970 and is the largest professional association for social workers in the UK with 20,000 members. It aims to provide the highest standard for social care. So BSW seeks to regulate the social work, not carers, but social workers. Okay, they regulate social workers. So they look into their policies, review what they need to do, and make sure code of ethics or ethical code of practice are adhered to, and you don't do anything contrary to what social workers should do pertaining to their skills and professional standards. Okay.
Okay.
Yes. So these are what we mean by um okay, so we have the code outlines a range of ethical and professional principles that underpin nursing and midwifery practice, including principles related to respect for anatomy, person-centered care, confidentiality, and accountability. What it means is that we are accountable for our actions and inactions, don't we?
Yeah.
Yeah, so as a carer or a nurse, you need to know that you are not isolated. Anything that you do, it must align with ethics and the code of practice. So if you're a carer, you may have what we call the DBS. Okay. If you're a nurse, you may have what we call the NMC. If you're a doctor, you have a GMC. So they regulate and come out with practice, what we call the best practice that nurses have to follow, or doctors have to follow, or carers have to follow. And you are accountable for your actions and inaction. That is why a nurse can go to prison, a doctor can go to prison. You don't do things on your own. You need to conform to the care plan. You need to confirm as a doctor, you have what we call the decision, the agreed decisions of what the patients should do and what you have to do, the medications and all that. You have to comply with what the law says. Okay.
Yeah.
Okay. So then we have the Royal College of Nursing. They are associations that you can join as a nurse or a carer. They help in ensuring that when you have any issues, they can stand in to help. It's called so RCM principle of nursing are based on 9 key principles, which are centered around the needs and experience of patients, and which emphasize the importance of compassion, respect, and dignity in nursing practice. The 9 principles are promoting professionalism and trust, prioritizing people, practicing effectively, preserving safety, promoting autonomy, collaborating with others, delivering person-centered care, improving health and well-being, and promoting learning and development. Okay, very important. 1 minute. Do you have any questions at all?
As I didn't. Can I? Am I going to get the recording so that?
Yes. You got a recording. Okay. You are going to get a recording. Okay. So let's look at some of the key ethical and legal issues when it comes to healthcare. One, what we call informed consent. Okay. Informed consent is a fundamental ethical and legal principles in healthcare, and it refers to the right of patients to make informed decisions about their healthcare. This can include decisions related to medical treatment, research participation, and end-of-life care. Okay. So informed consent is a fundamental ethical and legal principle in healthcare, and it refers to the right of patients to make informed decisions about their healthcare. Very, very important. The patients have the right to make decisions in their healthcare. Even if the patient doesn't want to take medication, you cannot force them, can you?
No.
You can only write it down and then adhere to what the patient wants. Confidentiality, I've already explained confidentiality. Duty of care, I've explained duty of care.
Yeah.
I've explained the autonomy versus healthcare professional must balance the principle of patient autonomy, the right of patients to make decisions about their own care, with the principle of benevolence, the obligation to do good and prevent harm. This can sometimes create ethical and legal conflicts, particularly in situations where patients are unable to make decisions for themselves. Okay. Then we look at mental health and capacity. Issues related to mental health and capacity can raise complex ethical and legal issues, particularly in situations where patients are unable to make decisions for themselves. Healthcare professionals must balance the need to protect vulnerable patients with the need to respect their autonomy and individual rights. Okay. End of life care. I mentioned that there is a complex ethical and legal issue that raises questions about the right to die, provisions of palliative care, and the right of life sustaining treatments. Healthcare professionals must navigate these issues while ensuring that patients receive care that is compassionate, respectful, aligned with their values and preferences. The key word is preferences. They have preferences when it comes to end of life. And then we spoke about resource allocation, okay? The ensuring high quality care. Professionals code of practice provide guidance on best practices and standard of care, which helps healthcare professionals provide high quality of care. Once you are able to adhere to all these ethical legal frameworks, it means that you are going to provide high quality of care. You are able to also promote ethical behavior. Professional code of practice establish ethical principles and standards for behavior, which helps healthcare professionals to navigate complex ethical issues and make decisions that are consistent with ethical principles. Okay, providing guidance on legal issues, supporting professional development. Professional codes of practice provide guidance on ongoing professional development, which helps healthcare professionals to stay up to date with new developments in the field and to continually improve their knowledge and skills. Okay, then these are the references. These are the references that um, you can go by. So your reference should always be the Harvard style of reference, okay?
Yeah.
The Harvard style of reference. Your font size should always be 12. And make sure that if there's anything that you refer to your references according to Royal Nursing, blah, 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 according to the World Health Organization, you must always reference it, okay? All right, so we come to the end of our lectures. Do you have any questions at all?
Oh, no, thank you.
Okay, so you could get a recording and you'll be fine. Okay, but I'll mention two things that let me go on top. So principles of the ethical perspective of the health and social care, principles of ethics. The key principle of ethics is respect for the autonomy about the patient's rights, benevolence, doing good and not causing any harm, non-mobisa, not doing anything wrong against the patient, and justice. But there are four principles of ethics. Okay, these are the four principles. Where we say autonomy means that you refer to a patient's individual right to make their own decision. Benevolence is a principle that involves taking action that promote the well-being and the health of the patients. Okay. Where we say non-malfeasance, the principle that involves avoiding action that may cause harm to the patients. Justice, principle that involves treating all patients fair and equal. You can say equality, okay, regardless of their background, their religion, or their ailment. Then confidentiality, respecting the patient's personal privacy and keeping their personal information confidential. Then lastly, fidelity. It involves being faithful to commitments made to patients and maintaining their relationship of trust with them. Okay. Then patient safety. Patient safety is ethical and legal reasons that can impact patient safety, leading to harm or even death. Very important. Healthcare providers must ensure that they follow the ethical principles of benevolence. For instance, if you have to hoist a patient, there are best practice you have to follow, isn't it?
Yeah.
The patient is very huge. You have to use the sling, isn't it?
Yes.
You have to use, if the patient is bedridden and is very huge, what do you use? Best slide, isn't it?
Yes.
So these are things that we have to follow patient safety. Very, very important. You have to follow patient safety. Then trust and confidence. Trust and confidence. It can public trust and confidence in healthcare providers and organizations. Patients and their families must have confidence that healthcare providers will act in their best interest and that their privacy and confidentiality will be protected. And then lastly, professional accountability. I mentioned that we are accountable for our actions and inactions. Okay. We are very accountable for that. So I'm just giving a brief lecture on what we did before, just a brief one. But if you get a recording, you'll be fine. Okay.
Okay.
All right. See you. Best of weekend. I think we have a lecture LO3 that I didn't lecture on, so I'm sure maybe we can do that tomorrow. I'll let them reschedule it. Okay.
All right.
All right. Take care.
Yeah. Thanks.
You're welcome.